Hello, everyone. My name is Sean Russell, and welcome back to HT1000 Introduction to U.S. Healthcare and Delivery. In this video, we will be looking at the continuum of care, and by the time we're done, we'll have examined the 4 different types of the continuum of care, as well as look at some examples for each of them. So let's get started. The continuum of care is a complete range of programs and services. The Joint Commission defines a continuum of care as matching an individual's ongoing needs with the appropriate level and type of medical, psychological, health, or social care service. The continuum of care contains 4 levels: the primary, secondary, tertiary, and quaternary. Primary care services include preventative and acute care, are referred to as the point of first contact and are provided by a general practitioner or other health professional, for example, a nurse practitioner or a physician's assistant. Basically, someone who has first contact with the patient seeking medical treatment. And this also includes your general dentist, your eye doctor, your ophthalmologist, and even your pharmacist for pharmaceutical services. These services are usually provided in an office setting where the care is continuous. For example, your quarterly office visits for a chronic condition, or for comprehensive, like your yearly checkups for preventative and medical care. A primary care provider manages and coordinates the patient's care, including referring the patient to a consultant for a second opinion. Primary care services include the following: annual physical examinations, early detection of disease, family planning, health education, immunizations, treatment of minor illnesses and injuries, and vision and hearing screenings. Okay. Then moving on to secondary care. Secondary care services are provided by medical specialists or hospital staff members to a patient whose primary care was provided by a general practitioner who first diagnosed or treated the patient. The primary care provider refers the patient to the specialist. For example, a family practitioner could see a patient who has an unusual respiratory condition and provides primary care, and then refers the patient to an internist that actually specializes in respiratory disorders. The internist then becomes the source of secondary care. However, with respect to these referrals and payment, in the United States, self-referral is actually a thing and is often performed by patients seeking secondary care services directly, instead of being referred by a primary care provider. This is very different from the practice that's performed in other countries, such as the United Kingdom and Canada, where all patients must first seek care from a primary care provider. For example, the emergency department physician or their family doctor. Okay, that individual, the doctor, then decides whether to refer the patient to secondary or tertiary care providers. And this is enforced in these countries by the fact that if a referral is not made by a primary care provider, then the secondary care provider is not reimbursed by these nationally funded healthcare systems. Well, in the US, we of course do not have a nationally funded healthcare system. So in the case of self-referrals, a reimbursement is actually dictated by the patient's insurance company. And some plans require referral while others do not. For example, an HMO usually requires referrals while PPOs generally do not. Okay. Let's move on to tertiary care. Okay. Tertiary care services are provided by specialized hospitals equipped with diagnostic and treatment facilities, which are not generally available at hospitals other than primary teaching hospitals or levels 1, 2, 3, or 4 trauma centers. Tertiary level of service is also provided by doctors who are uniquely qualified to treat unusual disorders and ones that do not respond to therapy that is generally available as secondary medical services. An example of this is say in the case of a severe traumatic injury, the stabilization service, uh, which are provided by tertiary care facility or designated level 4 trauma center when it's necessary to ensure within reasonable medical probability that no material deterioration of a patient's medical condition is likely to result from or occur during the transfer of a patient to a tertiary care facility. Um, Other examples of tertiary care centers include burn centers, cancer treatment centers, and facilities which perform organ transplants. Okay, the final one we're going to consider are quaternary care facilities, and this is quaternary care is actually considered an extension of tertiary care. And actually, sometimes when discussing the continuum of care, you may only hear that there are 3 levels of care, and this is why, because some folks consider the quaternary to be actually part of tertiary, but in this class we consider them as separate, their own thing. And but still, it is still an extension of tertiary care and includes advanced levels of medicine that are highly specialized and not widely used. The best example of these are just experimental medicine, and these are usually very costly, and this type of care is also usually provided by the tertiary care centers. Okay, so that covers the continuum of care. So in summary, in this video, we discussed the continuum of care and looked into primary, secondary, tertiary, and quaternary care. Okay. Going forward, as you reflect on this topic and prepare to do the rest of your work this week, please use this content in addition to materials in your readings, interactives, and your own research in the UMA library or other reliable sources to maximize your learning.